Good afternoon. My name is JJ Geis. I'm the director of the Vascular Surgery Program here at the Pulse Heart Institute. And I just want to first thank you for your time and this opportunity for myself and this team to present to you our QR code check-in solution. Along with myself, there's Roberto Costa, who's going to be looking at operations, Sean Dreyer, who's going to tackle finance, and then we'll finish up with Steve Sanders and marketing. What we have here is a very familiar scene from any waiting room across the country. Overcrowding in waiting areas is a systemic problem within the healthcare systems. The pandemic is forcing change. We need to reevaluate how we can do this, as this is no longer an acceptable job solution. We need to focus on efficiency and creating a safer environment for our patients. So we think with our QR code check-in process, we have an opportunity. And that opportunity will reduce wait times, reduce overall cost of Pulse Heart, and increase billing. We think that as we increase the efficiency here, we can conservatively add one patient per provider every day. Now, the patient experience starts in the waiting room. Redundant questions, loud atmospheres, fear of exposure now, and long wait times are all moments of struggle that every person faces every time they come to a clinic. We have a window now to change how we do that and create a new job solution. The goal here is to create a safer, faster, and secure digital check-in from the comfort of your smartphone. So this solution is available on any smart device and will increase throughput, reduce exposure, increase patient sense of security, and increase overall efficiency. The American Hospital Association just published an article that all outpatient clinic visits and procedures were down 34.5% last year during the pandemic. This increased sense of security and safety will bring these patients back to the clinics. Digital management solution is a suite of applications and increased access for our patients that can be utilized on any smartphone device. Roberto is going to take it from here and walk you through the operations of this new product.
Hello everyone, my name is Roberto Costa and I will give you a quick overview of the current doctor's appointment process and about how we plan to improve it. If we think about the current solution for medical visits, we immediately think of crowded waiting rooms, long waiting times, unclear insurance coverages, unexpected bills. The pandemic has only aggravated the whole process, making it even more stressful and adding health concerns. Visiting a physician can be quite an uncomfortable experience nowadays. So how is the process? We typically are asked to fill documents related to our personal records and sign acknowledgement forms. This can be very time-consuming and stressful. Patient then provide medical insurance and engage in discussions about what is covered and what's not. This is followed by more waiting time and a relatively short face time with the doctor. Following the medical visit, patients need to wait several days to get access to their medical records and treatment plans. So the question is, what can be done to improve this process and eliminate or reduce the pain points associated with it? At PHI, we believe we have a solution for it. And before getting into the details, I would like to give you a high-level introduction to the main components of the system, and then describe how all the pieces of the puzzle fit together. PHI's patient management system has three main components that work together to provide an innovative solution. The patient portal is a website that provides access to the patient's database. Patient can use the portal to load their personal information, retrieve treatment plans, schedule appointments, or print out their QR codes. The QR codes can be used at the medical provider office to check in through the check-in kiosk that will be installed at each facility. A large screen will display the expected waiting times for every patient. The last piece is the mobile app, which is actually the most important piece of the solution. It will allow patients to perform all the activities of the patient's portal. Load and retrieve information, schedule appointment, etc. And it will also allow to access the QR code for check-in. And through the mobile, patients will have access to their medical records, treatment plans, and will be able to get a better understanding of their payments and what will be covered by the insurance plans. No more surprises. So the idea is basically to split the current medical visit process in two parts. Our patients will need to load their personal information on the database only once. The portal will provide the ability to check the doctor's availability, schedule appointment, and receive confirmation directly on the mobile. At check-in, the patient can provide a printout of their appointment's QR code and pull it up for their mobile apps. As they scan the QR code, the app will automatically pass all the precompiled form to the doctor's office system, which will save precious time for the patient and for the medical staff. Insurance information will be also shared at that time. The additional time that is saved through this combination of patient portal and mobile app will allow more face time between the doctor and the patient. PHI will also be able to accommodate more doctor's appointments thanks to the increased availability of the staff. The PHI mobile will have a clean, simple interface. The homepage will include the main links .
Hi, everyone. My name is Sean Dyer, and I'm going to talk a little bit about the revenue streams and how we think we can actually make money on this new solution. When we originally came up with this idea, it was meant to enhance the patient experience in having to go through the medical check-in process. As we got further and further into this, we found that there was tremendous revenue opportunities through a more efficient check-in process, and that we could actually increase revenue to PHI. We do feel, just through our research, is that we could get one additional patient visit per day for every provider. And any given day, we have 59 providers working in a clinic. Each visit would generate an additional $250 in net revenue, which gives us incremental revenue of $14,750 per day. Each provider works about 45 weeks per year, factoring time off and holidays, giving us a yearly estimate of $3.2 million in increased incremental revenue. Now, we've actually adjusted that number down slightly to factor for seasonal factors such as deductibles and cancellation rates of appointments. And there are opportunities looking into the future. This is sort of a back burner project to do a joint venture with Epic and sell this system to other healthcare systems and basically charge like a subscription fee or a royalty for this. We haven't factored in any of those revenues. All the revenue streams are basically just the potential within PHI currently. We also feel that there are some SG&A efficiencies that we could recognize as well. We do think that we could reallocate or retire one FTE per Pulse clinic. Currently, those positions are more clerical in nature, and they have a cost associated of $45 to $55K per year. We feel that we could recognize cost savings of $1.35 to $1.65 million in either cost reductions or reallocating those positions into more productive uses within PHI, such as in our research arm. This is where we get into the costs. And the biggest cost, of course, is just going to be getting the system up and running. The software development cost is going to be the biggest at $378,000. And then we have the queue management system, which basically involves installing kiosks, the software license, and also computers and monitors at a total cost of $408,000, giving us a total cost upfront of $786,000. which we can depreciate on a straight line basis over 5 years, giving us a depreciation expense of $157,200 in year one. If we're seeing more people, that kind of leads us into our variable costs. If we're seeing more people, we have to pay our providers to see those people. And we've got variable provider wages at $1.148 million. This is going to be our biggest variable cost. We also have a patient data management portal that we'll have to maintain at a cost of approximately $200,000, giving us total variable costs of $1.348 million. Everything else is basically going to be assumed as fixed costs, biggest one being SG&A expense, which we've estimated at 17% of projected year one revenues, $545,000, and total fixed costs, which factors in training costs, maintenance fees, $633,000. So we have total costs of $2.138 million in year one. So when we factor in the expenses, when we factor in the revenues, we've got total revenues of about $3.2 million in year one. As mentioned, the variable provider wages and the patient management system, total of about $1.348 million. Contribution margin of $1.8 million in year one. Factor in SG&A, software, depreciation, maintenance, and training costs, total costs of about $790,000. Giving us earnings before interest and taxes of a little over $1 million. We have a contribution to Uncle Sam, of course, of $240,000 estimated, giving us net income of $829,000 estimated in year one. I'm going to pass things over to Steve, who's going to talk a little bit about our marketing plan.
Hi, my name is Steven Sanders, and I'm here to close us out today. I want to talk specifically about why we believe the PHI digital check-in system will work, along with how we want to launch. While we were building the prototype, we did research around attribute importance. Specifically, we wanted to measure how potential consumers would feel about various aspects of the system itself. We measured price, access to treatment plan, time with provider, medical record access, and check-in. While obviously price was the most important attribute to potential consumers, we did learn that medical record access and access to treatment plan were the second most important attributes of the system that customers are looking for. Surprisingly, we found that the least important attribute was actually increasing time with the providers themselves. We then conducted product testing, hypothetical testing where we pitted the PHI check-in app against tablet check-in and the traditional staple clipboard paper check-in process that medical providers are using today. Again, we wanted to measure attributes against these three systems, specifically understanding of treatment plan, price, brand, time to access medical records, check-in time, and time with provider. Each of them were assigned different values of these attributes, and we tested consumers to see which attributes would be most important in the solution. Once again, we found that understanding of treatment plan was very important, similar to the research findings. One surprise that came up was actual brand was important to customers. So we feel that the PHI has good brand recognition, and that will definitely be a value as we launch the product. Additionally, check-in time was found to be important, and pricing or co-pays could have been important. Similar to the research that we conducted, we found once again that potential customers found time with their provider the least important attribute. So in relation to the three systems, we measured for a total utility based on those 5 attributes and how customers perceived the value of each attribute with this product. So for us, we found that PHI's digital check-in solution provided the most utility as it had the biggest increase in all those attributes that were most important. The only attribute that it did not have the highest utility for potential consumers was in pricing, because we chose to price it at the highest to see what the impact was. When we conducted our first choice analysis, we found that the PHI digital solution was picked over 75% of the time, showing us that we have a substantial advantage versus the tablet check-in solution and the current solution of paper check-in. In terms of launching the product itself, we wanted to focus on 5 marketing channels: social media, social and display ads, so streaming, offline ads on TV, radio, viral marketing, and public relations. PHI's target demographic is over 50 because of our heart and vascular focus, which impacted where we wanted to spend dollars in the marketing channels. We also believe that we can leverage and utilize PHI's current marketing strategy and marketing plan and actually use the digital check-in solution as an attribute overall for PHI to increase our patient frequency. So with a budget of around $400,000, we're looking at specific channels inside of social media and then offline ads. Our target demographic, we feel, is best found in Facebook, Nextdoor, Pinterest, along with content creation costs for all the channels. Social and display ad content creation, and then in the TV world, History Channel, Discovery, Nat Geo, Weather Channel were all the top 4 channels in our demographics. So the content creation that we're putting together, really we wanted to focus around teaching people the attributes of the app and how to use it. Again, budget summary, we're looking at spending $400,000 to launch this, and we feel very, very confident that we've got a winning product that will put PHI in a much better position to recruit potential customers to our providers. With that being said, does anybody have any questions? And if they don't, we thank you for your time today, and we look forward to working on rolling this product out.